The coronavirus knows no boundaries. That makes it even harder to fight in the Palestinian territories, which are pockmarked with borders and checkpoints. Then there's all the misinformation about COVID-19 and the vaccines. Still, the vaccination rate in the West Bank and Gaza is now around 50%.
Vaccination has become easy. It's accessible everywhere, in parks and public areas. Most vaccination centers are overcrowded, with a very high influx of people.
Officials say a vaccine mandate for civil servants has helped push the rate higher. I'm Ben Fazoulan. The pandemic is adding another layer of difficulty to life in Gaza. Because it's taken so long to get that vaccine drive going, hospitals are strained. The health system was already in a mess. The economy too. Here's our correspondent Tania Kraemer from Gaza City.
Here in the center of Gaza City in Al-Wahda Street, workers are still clearing the rubble of a building destroyed in the conflict between Israel and Hamas in May, one of the several continuing crises. A few blocks away, Dr. Shadi Awad and his team have been fighting the coronavirus pandemic at Gaza's largest hospital, Al-Shifa Hospital. This ward is dedicated to testing and treating patients suspected of having a COVID-19 infection. While the number of seriously ill patients has slightly decreased in recent days, infection rates remain high.
We used to categorize these cases in people who could be sent home and treated at home, and cases who were admitted and treated in hospital. Some were sent to intensive care. We've been in this latest wave of the pandemic for a month. It's been the biggest and most intense wave since the beginning of the pandemic here in Gaza.
The staff are exhausted, the doctor says. Over 1,500 people have died of COVID-19 in Gaza. The pandemic has further strained an already weak health system and dire economy. The small territory ruled by the militant group Hamas has been effectively cut off by Israel and Egypt for the past decade. Although scarce in the beginning, vaccines have become increasingly available, but more people need to take them.
Still, we will work with the community in engagement with the community and help the authorities here to spread the facts and the safety of the vaccine and to encourage people to get the vaccine. At the moment, Gaza has reached 40% of vaccination among the targeted population.
Roughly 1.2 million out of Gaza's 2 million inhabitants are eligible to get a jab at a vaccination center like this one. Authorities have made vaccinations mandatory for certain categories of people, such as those working with the public. However, reactions are mixed.
In Gaza, there are a lot of problems. It's very crowded. There is a lot of mixing in the workplace, in schools, among students, even with the elderly. Our society is very closely linked, so vaccination is very important. I took the first and second dose of the Sputnik vaccine, and now they've sent us the third dose.
Here, people are generally not that concerned about taking precautionary measures. They don't care about corona that much anymore. I feel that people are just going along with things, so COVID is not affecting them like it did before. Maybe the most important thing is the economic situation.
While the pandemic continues to weigh on daily life, it is just one of the several ongoing crises people have to deal with in Gaza.
And the vaccination rate is even higher since Tania filed that report for us. Let's talk about the difference, though, between the vaccination rates in Israel and the Palestinian territories with Hassan Jamil Zawahra. He joins us from Irbid in Jordan. Tell us about this big gap between the two. Can you explain that to our viewers?
Yes. You know, Palestinian Ministry of Health have acknowledged that the capacity to contain the spread of COVID-19 is limited by ongoing and pre-existing shortages in a healthcare system, including medication, disposable equipment. And if we look to the statistics of vaccination rate among regional countries, we see that Palestine have similar vaccination rate to those countries such as Jordan, Lebanon, and Kuwait. Recently from mid-August until now, vaccination rate has been increasing because, people want to go back to work, to normal life, to universities. I think, we can't compare well-occupied healthcare systems, having difficulties. Even those well-occupied health system having difficulties handling this crisis. So imagine how a fragile health system in occupied territories to suffer from this crisis. So I think there is one fact, which is the inequality of provision of medical service. Vaccine issue are a small part of a big and complex story.
So you put it more down to a lacking healthcare system rather than the Palestinian territories or Israel playing politics here. Why then is the system so bad for Palestinians?
The healthcare system in Palestine, have faced many unique challenges during the pandemic. The main challenge is the Israeli control over the border, restrictions of movement between districts, the geographical separation between West Bank and Gaza. Add to these difficulties, financial crisis and limited resources for the Palestinian Authority. So we don't have capacity, to buy vaccines. We need to wait until donation, for example, from COVAX initiative to give us the vaccines. In addition to that, pre-existing stressors to the health system, shortages of health worker, and community resistance to the reality of pandemic. And add to all of this, what has been mentioned in Fourth Geneva Convention, that the occupying power, has to ensure and take prophylactic and preventive measures necessary to control, the spread of contagious and epidemics in occupying territories without bias.
Exactly. You just brought up Israel's responsibility according to international treaties there, and you also mentioned COVAX, but what about Israel's supply of vaccines? Does it have a surplus, part of which is going to the Palestinians?
My direct answer to this is no. They tried to sell us near expired lots, but the deal was canceled. We are the Palestinians, have the right to have valid vaccine. People are not lining up in front of clinics. We have a challenge to convince people to take the vaccine. So we need a valid vaccine, so we have more flexibility, to transport those vaccines and store them. That's it.
Okay, Hassan, Jamil, Zawahra, thank you very much for being on the show today. Well, there's been so much focus throughout this pandemic on the prevention of COVID-19 and vaccines. Treatment is just as important. Question for Derek Williams.
If I get COVID-19, what treatments are available?
Treatments for COVID-19 can be roughly broken down into two categories. The first encompasses drugs that are meant to be given at earlier stages of the disease to keep it from getting any worse. They include what are called monoclonal antibodies, often called MABs, which are antibodies made not by the body, but in a bioreactor. Several different types have been approved for emergency use in a number of countries. But MABs are expensive to manufacture. Then there's convalescent plasma. It's a lot cheaper because the antibodies in it don't have to be manufactured. They come from the blood of people who have recovered from COVID. The only problem is that several important studies have shown that convalescent plasma has at best a very limited impact on disease progression. Many healthcare authorities now limit its use or have stopped using it entirely. Then there are antivirals, which also need to be given early, generally in symptomatic disease, to have a really positive effect. By interfering with viral replication, they help reduce viral load, which gives basically your immune system some time to catch up. The best known antiviral is remdesivir, which has been used to treat COVID since the early days of the pandemic. But its effectiveness is also hotly debated, and it has a big drawback, which is that it has to be administered via an IV in a medical setting. That's not the case for a promising new antiviral called molnupiravir, which has yet to be approved. It can be taken in pill form by patients at home. Finally, there are drugs given to late-stage patients with serious illness. The most widely used of those is called dexamethasone. It's an anti-inflammatory steroid that's administered to calm a patient's immune response when it's spiraled out of control and is doing more harm than good.